रिकॉर्ड नहीं
तुरने सर, ओवर टू यू.
सुरू करायचं सर? आले, जॉईन झाले?
हाँ, स्टार्ट सर, प्लीज स्टार्ट.
Good morning. On behalf of Maharashtra University of Health Sciences, Nashik, I welcome Professor Dr. Abhimanyu Kumar sir, Honorable Vice Chancellor of Dr. Sarvapalli Radhakrishnan, Rajasthan Ayurveda University, Jodhpur, Rajasthan. Today he will deliver lecture on care of children in COVID-19 pandemic. Today we also have President MCIM and a Senate member of Maharashtra University of Health Sciences, Dr. Ashutosh Gupta sir with us. I request Honorable Dr. Gupta sir to kindly deliver welcome address. Gupta sir.
यहाँ पर उपस्थित प्रोफेसर डॉक्टर अभिमन्यु कुमार सर, आयुर्वेद फैकल्टी के डीन हमारे गुरु डॉक्टर श्रीकांत देशमुख सर, इस लेक्चर सीरीज के कोऑर्डिनेटर डॉक्टर आवाड़े जी, यूनिवर्सिटी के पीआरओ स्वप्निल तोरणे जी और सभी महानुभाव जो लोग यूट्यूब के माध्यम से हम सभी को सुन रहे हैं। कल डॉक्टर HR नागेंद्र जी गुरु जी के उद्बोधन के बाद आज इस लेक्चर सीरीज में दूसरा पुष्प आयुर्वेद के बारे में जानकारी देने के लिए प्रोफेसर डॉक्टर अभिमन्यु कुमार सर हमारे बीच उपस्थित हैं। विगत 35 से ज्यादा वर्षों से सर ने आयुर्वेद के क्लिनिकल रिसर्च में एक बहुत अच्छा काम किया है और कई देशों में वो काम की तारीफ भी हुई है। 13 से ज्यादा पुस्तकें आपके द्वारा लिखी गई है और 135 से ज्यादा रिसर्च, 150 से ऊपर रिसर्च पेपर आपने लिखे हैं। और आज का विषय जो है, जो सभी आम जनता के लिए, नागरिकों के लिए बहुत चिंता का विषय है, जो बहुत ही भावना से जुड़ा होता है। कोविड तो हर आदमी में परिवार की जो स्नेह है, प्रेम की भावना रहती है, लेकिन बच्चों के बारे में बहुत ज्यादा कॉन्शियस एक जनरेशन है। कुछ दिनों पहले मैं अपने कुछ सहकारियों से बात कर रहा था तो टीवी पे इतनी सब न्यूज चल रही है, तो बच्चे, छोटे बच्चे 8 साल के, 10 साल के डिप्रेशन में जा रहे हैं कि मुझे कोविड हो जाएगा क्या, तो मैं रात में सो जाऊंगा तो सुबह जागूंगा कि नहीं। तो ऐसे डिप्रेशन के शिकार भी बच्चे दुर्भाग्यवश हो रहे हैं और तीसरी वेव में बच्चों पर बहुत ज्यादा असर होने की संभावना कई लोगों ने बताई है। इन सब चीजों को ध्यान में रखते हुए प्रिवेंटिव एस्पेक्ट से आयुर्वेद के डॉक्टर की तरफ बहुत आशा से समाज निगाहें लगाए हुए बैठा है और प्रिवेंशन की दृष्टि से, प्रिवेंशन के बाद अगर कोविड होता है तो ट्रीटमेंट की दृष्टि से और कोविड होने के बाद पोस्ट कोविड मैनेजमेंट की दृष्टि से आयुर्वेद की क्या भूमिका रह सकती है, यह कौन रखेगा, यह विषय जब यूनिवर्सिटी के सामने आया तो मुझे लगता है कि डॉक्टर अभिमन्यु कुमार सर जितना अधिकारी पुरुष इस विषय में और कोई नहीं था। इसलिए मुझे आज बहुत खुशी है कि सर ने आज कोविड की इस महामारी में बच्चों की चिंता कैसे हमने करनी चाहिए, ये डॉक्टर के एंगल में डॉक्टरों को समझाने का जिम्मा उन्होंने खुशी से स्वीकार किया। और मुझे विश्वास है कि आज आपके मार्गदर्शन में जो ज्ञान मिलेगा उससे पूरा समाज जो है वो लाभान्वित होगा ही, क्योंकि आयुष मिनिस्ट्री ने थर्ड वेव को ध्यान में रखते हुए जो कोई गाइडलाइन बनाई, जो कुछ टास्क फोर्स बनाया और विशेषतः बच्चों के लिए जो कुछ विचार इसमें किया गया है उसके भी आप प्रमुख है। और मिनिस्ट्री ऑफ आयुष ने आपके नेतृत्व में जो कोई गाइडलाइन इस विषय में तैयार की है ये भी अभी प्रस्तुत की है। तो मुझे लगता है इस आधार पे बच्चों की चिंता हम कैसा करें, इसमें बहुत अच्छा मार्गदर्शन आज का रहेगा। यही विश्वास के साथ मैं आपका बहुत बहुत स्वागत करता हूं। आपने एक यूनिवर्सिटी के आप वाइस चांसलर है, इससे पहले एक यूनिवर्सिटी के वाइस चांसलर रह चुके हैं और आज एक तीसरे यूनिवर्सिटी के आयुर्वेद के बहुत छात्रों को और अध्यापकों को आप मार्गदर्शन करने के लिए आए, ये हमारे लिए बहुत हर्ष का विषय है। आपका सर बहुत बहुत स्वागत। महाराष्ट्र आरोग्य विज्ञान विद्यापीठ की ओर से मैं आपका स्वागत करता हूँ। धन्यवाद।
Thank you very much, Honorable Dr. Ashutosh Gupta sir, for your welcome address. Now I request Dr. Shrikant Deshmukh sir, Dean of Ayurveda Faculty of Maharashtra University of Health Sciences, to kindly introduce our today's eminent speaker.
Thank you, sir. Good morning to one and all. This is an honor for me to welcome Dr. Abhimanyu Kumar sir. for this today's program and in the series of these lectures arranged by our MHS Nashik. It is indeed an honor for me to have with us Honorable Vice Chancellor Professor Abhimanyu Kumar sir. Presently, he is working as a Vice Chancellor as Dr. Sarvapalli Radhakrishna Rajasthan Ayurveda University Jodhpur, and also served as Uttarakhand Ayurveda University Dehradun, involved in an academic, clinical and research activities for last 35 years in various capacities. He did his post-graduation in pediatrics, also awarded as a PhD, and later on received his master's degree, MSc in applied psychology, and also diploma in yoga. He has authored and edited 13 books, contributed as a chapter author in 3 books, and published more than 151 research papers in various scientific national and international journals. Also served as Director General in charge for the Central Council of for Research in Ayurveda Sciences, that is CCRAS, New Delhi, Ministry of Ayush, Government of India. As a founder director of IIA, that is the All India Institute of Ayurveda, New Delhi, made the institute fully functional with accreditation of NABH, and then research lab, post-graduation in 13 specialties, and made a lot of MOUs with leading organizations like ICMR, AIMS, New Delhi, CCRAS, Jawaharlal Nehru University of Delhi, Delhi University, IIT Delhi, European Academy for Ayurveda, Germany, etc. He has developed this Indian Institute of Ayurveda, New Delhi, and he became the member and Ayurveda expert in various national and international universities, institutes, and organizations. He has supervised 68 MD scholars and 10 PhD scholars, and he has completed 2 international collaborative research projects and 2 others sponsored by Government of India projects. 2 industry institutes based collaborative clinical research projects had also been completed. Involved in teaching and training for the international scholars, worked as a member secretary of Ayurveda Pharmacopoeia Committee, Pharmacopoeia Commission of India. He has been nominated a member for the steering committee constituted by the Planning Commission for the 11th 5-year plan and 12th 5-year plan, Department of Ayush, Ministry of Health and Family Welfare, Government of India. Nominated by Department of Ayush, Government of India as National Coordinator for the clinical documentation in national institutes under the Department of Ayush. He is the Ayurveda expert and former head of the Department of Valroga, National Institute of Ayurveda, and ex-visiting professor, Department of Neurology, Scott and White Hospital, School of Medicine, A&M University, Texas, USA. He has been invited as a speaker by the Embassy of India, Berlin, Germany, Hungary, China, Brazil, Switzerland, Latvia, etc. He is the academic expert for the curriculum designing of the PG diploma course in Ayurveda, University of Debrecen, Hungary. He chaired subject committee for the revised the syllabus of DMS and MD Ayurveda for the Central Council of Indian Medicine, New Delhi. He has accompanied as the technical expert with the Honorable Minister of Ayush and Secretary of Ministry of Ayush, Government of India. This is the 3-member committee, and he visited to WHO, Geneva, that is the World Health Organization headquarters at Geneva, Switzerland, to sign our country's MOU, that is India's MOU with the WHO. It's warm welcome to you, Dr. Abhimanyu Kumar sir, and we are very happy to have you with us at MHS Nashik, and it will be a great opportunity for our all teachers, faculty members, our students, PhDs, and PG scholars and I wish and I request you to suggest us and guide us on this occasion. Thank you very much.
Thank you very much.
Over to you, Thorne sir.
Thank you very much, Honorable Dr. Shrikant Deshmukh sir, for your introduction of our today's eminent speaker, Professor Dr. Abhimanyu Kumar sir. Now, I request him on behalf of the Maharashtra University of Health Sciences to kindly deliver his lecture. Professor Dr. Abhimanyu Kumar sir.
Sir, shall we share screen?
Yeah.
Okay. Sachin sir, please share your screen and start.
Welcome to all in this presentation. Today's presentation is care of children in COVID pandemic. So my presentation is divided into certain points. Just like the first will be the basic introduction about COVID-19, including multi-system inflammatory syndrome in children. So, general care of children during COVID-19 pandemic, care for mental well-being, nutritional care, advisory for Ayurveda practitioners, probable third wave of COVID-19 and involvement of children in media review. So the first is that we all know that there is a coronavirus. So the structure, the outer layer is made up of protein, nucleoprotein. These are spikes, glycoproteins, and the inside is genomic RNA. So we know that all these structures, they are especially made up of the protein. The mode of transmission is mostly by three methods: the droplet method, aerosol method, contact method. Droplet, as we know that respiratory secretions from coughing or sneezing landing on mucosal surface. By aerosol, a solid particle or liquid droplet suspended in air, that is called aerosol, and that used to go inside during breathing. Contact of by touching something with SARS-2 virus on it, and then touching mouth, nose, and eyes. In some cases, even the fecal contamination or through fecal matter, this transmission of virus has been found. So these are certain specific surfaces. Just like on plastic, this virus used to stay for 5 days, on paper 4 to 5 days, glass 4 days. The least is on aluminum. It is 2 to 8 hours, even in surgical gloves, and it is for 8 hours it used to survive. So the incubation period, actually it is a time between exposure to virus and the onset of the symptoms. So normally in case of COVID-19, symptoms may show 2 to 14 days after exposure. So the people are most contagious when they are the most symptomatic. But in several studies, it has been found that even before appearing the symptoms, a person may be contagious. So this is a just diagrammatic description about how a specific type 1 IFN concentration used to protect children and young people in comparison to older patients. So this type 1 IFN, it is a activator of antiviral genes, so that there is a protection from this virus, and especially for the multiplication, related to multiplication or the copying, that can be prevented. So here just see that in children and the young people, the concentration of type 1 IFN is more in comparison to older. So the complications are more in advanced age people, and the mortality is also high. So this is the whole mechanism how after entering into the lung, how this virus goes to alveoli, and from there a lot of changes used to occur, which ultimately produces widespread inflammation in lungs and in several other organs. So this is mean the advanced stage going toward the multi-organ damage. So in children, one must be very much careful to observe certain feature. So just like the fever lasting for more than 4 and 5 days, oral intake is decreased, child becomes lethargic or irritable. It may be he may be or subconscious. The oxygen concentration that used to drop below 95%. Even in some cases, eye involvement may be there, eye becomes red. There may be diarrhea, vomiting, or even pain in abdomen. So one must be very much aware of these symptoms, and also tell to the parents that if these symptoms are there, immediately they have to report to a specialist. So the Ministry of Health and Family Welfare, when they released advisories, so they classified severity grading for COVID-19 affected children, mild, moderate, and the severe category. Mild means the simply sore throat is there, rhinorrhea is there, cough is there. There is no fast breathing is observed in mild cases, while in moderate cases the breathing is altered, it becomes fast, and the rate used to change according to the age. Just like for 2 year, 2 month kid, it is more than 60 per minute. For 2 to 12 months, it is more than 50 per minute. So likewise, here in moderate severity, the concentration of oxygen that goes about or below the 90%. In severe category, the first thing is the cyanosis. You will observe cyanosis, especially on lips, tongue, and the SpO2 level goes even below down and below 90%. Here you can observe the grunting. Grunting means the increased respiratory. When the increased respiratory effort is there, so the accessory respiratory muscles used to work, so you can observe grunting and severe retraction of chest. Child is lethargic, and sometimes even due to the lack of oxygen, seizures, means the convulsions may be there. So this is again a associated condition with COVID-19 children, multi-system inflammatory syndrome in children. Of course, only few children they were noticed during this the second wave, and the average age of the affected children was noticed at about 8 years. So usually it used to range from 3 to 12 years. So here the children, when they develop MIS-CS after COVID, so it depends on the involvement of organ, just like the heart, lung, blood vessels, kidney, digestive system, brain, skin, eyes. So the severity and the involvement of organ, that decides the clinical feature. So this is the whole mechanism, how just after infection, how different type of autoimmune or autoantibodies are formed. Then they used to proceed further to damage different body organs, just like initially the fever may be there for more than 4 or 5 days, involvement of eye, then myocardial involvement, pain in abdomen, vomiting, diarrhea, the headache may be there, the altered sensorium is there, in lungs it is cough, respiratory distress. So these symptoms may be there, and these children, they require hospitalization, because this situation is a life-threatening situation, and that should be differentiated from normal COVID infection. So though it is rare, but Mm, uh, but of course, in any child, it may happen. So one must be very much clear about this disease and the features which are created by this disease, because features are very common. Just like here also, you will see that the fever that doesn't go away, abdominal pain is there, vomiting is there, diarrhea, neck pain, rashes, blood, hot eye, feeling tired. So these are common features. So one must be very aware about the normal COVID or COVID associated with MICS. So these are certain emergency warning signs of MICS. There may be severe abdomen pain, stomach pain, um, difficult in breathing. The skin becomes either pale, gray, or blue. You can see in skin, lips, nail pads. Confusion may be there, and the child may show the inability to wake up or stay awake. So after this brief introduction about the COVID and its involvement in children and the possibility of MICS. So here is a specific home care guidelines for children and advisory for Ayush practitioners about prophylactic care in children during the COVID-19 pandemic. So the home care, it is generally divided into 6 major points. So the first is general care, then diet, exercise means the physical activity, sleep, the mental care of mental health, and use of Ayurveda interventions. So let us see all these areas. So during general care, the first thing is hand washing, because that is the most important to prevent COVID infection. So as we know all that minimum for 20 seconds hands should be clean. So here are a few steps, 5 steps to proper hand washing. Just like first is the wetting, then produce lather, scrub well for 20 seconds, then rinse with clean water and dry with clean towel. Second is, and the most important thing is the mask, use of mask. So here some tips are there, just like the children above 12 years of age, mask is mandatory. But the children between the age of 5 to 12, mask is mandatory under parent supervision. But in children who are 2 to 5 years of age, mask is desirable, but under the parent supervision. There are certain specific cases in which mask should be avoided. Children aged less than 2 years, having breathing difficulty, or unconscious children, inability to remove the mask without help. So by this way we can arrange the mask, and especially 2-layer or 3-layer mask is appropriate for children. For social distancing, one should avoid attending public functions, social gatherings, crowded places like parks, religious places, malls, market, and group play. Avoid traveling and stay at home in possible limits, because this advice is especially for parents to avoid travel. So at least preferably 6 feet or at least 3 feet distance should be maintained. For respiratory hygiene, we should educate children to cover nose and mouth with tissue paper or handkerchief, or with bent elbow, or in sleeves when coughing or sneezing is there, just like this way. Care should be taken that the droplet do not touch the palm or not liberated in the air. So one should ensure immediate and proper disposal of tissue paper and washing the handkerchief. Again, when the child is having coughing and sneezing, social distancing must be advised. There are certain general guidelines of a daily routine, means the dincharya. So it is advisable that the child should be offered lukewarm water to drink according to their capacity. Oral and dental hygiene is required, and um, for dental hygiene, through proper brushing morning and evening, and especially it is important for children who are above 2 years age. The children above 5 years, they can practice gandus by using 1 teaspoon of coconut or sesame oil, and after that, warm water rinse should be performed, so it will clean the mouth. Children who are above 5 years, or when they can hold, they can be advised for cavalcade or the gargle. So here the pinch of salt, turmeric in warm water can be used, or S2 Madhu and Triphala, or Suddhatankan or Madhu may be used for cavalcade. Abhang may be advised by plain sesame oil, coconut, or mustard oil. For nurse, below 6 year, oil, sesame oil, medicated oil, just like anutel or gobrat can be utilized by finger or by straddle earbud. For the children who are above 6 years of age, nasal instillation is recommended in doses of 1 to 2 drops in both the nostril, daily once. Physical activities, they are recommended, just like ask them to do yogasana, pranayama, meditation, and other exercises. And the best practice is that if the parents, they do all these exercises, pranayama, so the children, they can follow. So that is the best practice I would like to advise. Diet should be easily digestible. It should be fresh, simple, fresh, and warm. Means one should not use the food preserved, and especially the fast food or heavy food. So that should be avoided. Sleep is very important, because we all know that during this pandemic, what we observed during lockdown, the sleep pattern of children is quite disturbed. And that is again causing several health issues, especially related to the mental conditions. So here there is an advisory for minimum sleep, just like for teenager, about 8 to 10 hours of sleep is required. And for children who are, means the 6 to 12, 3 to 5, so average 8 to 10 hours of sleep is recommended for all, but it is more in case of very small children, especially under 2 years. So the whole dincharya should involve appropriate academic, hobby, prayer, and family time on very regular basis. So here there is example of some yogasana or physical activity, just like jogging, bending, trikonasana, surya namaskar, vrikshasana, bhujangasana. So this is a good example that most of the children, they can perform such type of physical activities or yogasana, especially when the child is above 5 years. It is very simple to perform. No, because when the child is small, he used to roam here and there in the house. So, and he used to touch several objects. So here there is a guide how we can clean or disinfect and use disinfectant for different items. So just like toys, bedding, floor, because they used to move very frequently on floor, their clothings, stripes, sports, mats, other play equipments, even the refrigerators, because the children, when they are means above 5 years, so they used to go to open fish by their own. So we must take care of cleaning, especially the refrigerator handles. Here, when we are cleaning all these materials, so one must be very much clear that whatever chemicals or materials we are using, that should be safe for children, because you know that that may cause more harm in case of children in comparison to adults. So here some Ayurveda recommendation is there. We can go for the environmental hygiene or by doing Dhupan Karm, and for that one can use neem leaves, sarsa, karpur, loban, and grath, and this can be done either once or twice a day. And when we are performing this Dhupan Karm, child should not be in that particular area of fumigation. So here are certain clinical situations, and sometimes parents may ask about these situations, and it will be very easy for a consultant or practitioner to have a very specific advice in these conditions, just like the perinatal COVID-19. So newborn baby of COVID-19 positive mother should be tested for COVID RT-PCR between 24 to 48 hours. Newborn with COVID-19 could be asymptomatic, sick look, having poor feet, with coryza, cough, and breathlessness. Another condition is there that if the mother is COVID-19 positive and the child is negative, so mother can take care of child if no better option available for child and mother is not too sick or hospitalized. Mother should continue to breastfeed the child. There is no issue related to that. So mother has to follow best possible sanitization, wear proper mask, keep social distancing as far as possible. When the mother and child both are COVID-19 positive, so in this condition, let the child be with mother unless mother is too sick or not hospitalized. In infant, continue breastfeeding as far as possible and feasible. If child is positive and parents are negative, so in this particular condition, still parents can take care of child in and out of the hospital. Or when in such scenario, the parents should use proper mask, personal protective equipment, even in PPE, they may use PPE kit when some serious situation is there. Child should wear a mask and follow respiratory hygiene. So these are certain features. Normally, we ask when this COVID pandemic is there. So even morning health check is a very useful way to rule out COVID-19 infection in children. So what sign we will observe? So about the general mood of the child, there is whether there is any change in behavior, fever or elevated body temperature, whether there is any rash on skin, complaint of pain and not feeling well, signs, symptoms of disease, just like the coughing, sneezing, breathing difficulties there, more discharges from nose. And one should use our senses. So just like look for any sign, listen for any complaint, smell for any unusual odor, and ask whether the temperature is high or fever is there. So this is a routine general health checkup for any child during this COVID pandemic. Now, care of mental well-being of children during this pandemic. So children who are at high risk of mental health issues during this pandemic, so in certain cases, certain children, they are more prone to develop this health issue. Just like the direct COVID-19 experience in self or in family, endemicity, death or severe illness of near and dear ones, quarantine child, isolation from the family is there. Children of frontline workers, they are also prone to develop health issues. Children who have no connect with the educational system and or their friends and extended family. Children whose parents are overoccupied, unaware of the special need of children during this pandemic, and children with physical, mental, cognitive, social problems, and even if family is having some financial classes, it used to affect the mental status of a child. So there are certain guidelines for parents how we can promote mental health in children and in adolescents. So children usually they see more, listen less. So parents should be a role model uh, for appropriate behavior so that their children can follow their footsteps. Maintain your own physical and mental health so that you are able to support your children. Bond with children emotionally and nurture this bond meaningfully. Give them unconditional love and sense of security, and these tips are for parents. Parents must follow all these things when they are inside home and when there is a situation of this COVID, severe COVID infection. Parents should patiently listen to their children, empathize, and deal with them very respectfully. Mental care for younger children, so special care is required for the younger children, so especially when the children below 5 years, they need more attention and the parental presence in time of stress. So cuddling, tickling, talking, singing, laughing, playing, these are the activities that reassure them. So engaging actively with them will ensure good cognitive development as well, because that is a very important aspect and that will affect in long term. So undivided attention for at least half an hour should be given for each child separately. So this is very important point. There must be a routine. Well, because when this pandemic situation is there and everybody inside a home, so normally every person is having his or her own routine, but there should be some common routine for all. And in that routine, children they should be part of that routine, and in planning of that routine, their opinions should be taken. So there must be time for a study time or for academics. So here the activity-based learning is a great way of learning, and that should be encouraged by making models, chart, figures, presentation, skits, poems, slogans based on their academic contents. So we must devise some innovative methods for academics, not simply the lecture method. Recreation and hobbies, a lot of time is there, so recreation is required, and some time may be spent for their hobbies also. So again, for this, find out innovative ways of engaging the child in resources you have, just like using food grains or the petals or various colors for making craft. If possible, make provision of indoor play and creative activity, just like the board games, art and crafts, reading, music. Try to avoid go for video games or the mobile games. So here means there is a guideline for the screen time. How much screen time one can allow for a child and that again depends on the age of child. Means, below 2 years, absolutely it is not recommended. For 2 to 5 years, 1 hour of co-viewing with engaging parents, 5 to 13, supervised by the parents, and 13 to 18. Again, here parents should be very much watchful what children's or the teenager children's they are going to watch with their mobile. So here there are certain specific clues to take care of mental health of children, because you know that during this pandemic, most of the time we are overexposed with the news, news especially the negative news. So child is not able to cope up of all these situations. So one must limit exposure to news, help follow a new normal with positivity, tell them how it helps rather than how difficult it is, assure them that this is a passing phase, instill hope by counting the blessings. These are the very basic thing that one should not overburden or overexpose with media related to the negative aspect of COVID. So parents should be very much careful, and they should observe the child for their change in emotions and behavior. So especially when the refusal to comply, altered eating and sleeping pattern, you observe if there is a weight gain or weight loss, sleep issues are there, physical complaints for any apparent reason, there is no apparent reason and they are having physical complaint. So all these points should be noticed seriously, and especially for young children when they are stressed, so they may show specific behavior, just like they become clingy, cranky, and throw frequent tantrums. They are not playful and becomes very fussy. So there is a limit, and there is a situation when that alarms that now it is the limit, and one should take uh, the help of or support of any expert. So when to seek for an expert? So there are certain specific points, just like any mood or behavior that is deviant enough to disturb daily routine, just like eating, sleeping, academics, and interpersonal relationship, and is lasting on most days over a 2 weeks time that needs immediate attention. Any severe emotional disturbance or features of sudden or several this severe mental disturbance, and especially in certain children, it has been observed that there is a tendency of suicide, very negative tendencies there, and that should not be neglected uh, by the parents, and it should be very clearly um, uh, told to the parents if any child is having developing such type of tendency, immediately they should contact to expert. In this corona pandemic, when the risk of COVID-19 is there, so it is very much linked with the child nutrition, because we know that the whole scenario is quite changed when they are staying home. The food is disturbed, their routine is disturbed, their physical activity is disturbed. So ultimately, it is going to affect their food habits and the nature of food they are taking. So here in Ayurveda, we are having certain tips to overcome with the situation. There should be some schedule for every child for feeding, just like when the children's up to 6 months. So exclusive breastfeeding is advisable, 6 to 24 months. So minimum 3 complementary food along with breastfeeding is advisable. Children with 2 to 10 years, minimum 4 meals. 2 main meals and 2 snacks, especially on demand, that is advisable. So similarly, in children from 10 to 16 years, minimum 3 meals are recommended. So here for cooking, some mild spices just like cumin, cinnamon, dry ginger, garlic, ajwain, haldi, black pepper. So they may be used because they used to help to protect the child from infections, and they used to boost the immunity also. The milk processed with haldi and sunti, that may be given to the child. So some children, they don't like the taste of sunti, so simply golden milk or the milk added with some turmeric, that can be advised. So especially the local and the seasonal fruits, vegetables are recommended. Whatever means we are giving as a liquid, and especially the water, so that may be treated with either with coriander or the cumin or the ginger, and preferably it should be given lukewarm to drink. And they should not practice the habit of eating occasionally, and they should be given food only when they are hungry. One should not even force children to eat more than he can take, and overfeeding, that should be avoided. Certain foods, just like, of course, uh, these foods are favorite for children, but the use should be uh, limited. Use of ice cream, chocolate, sweet, bakery, snacks, fried fast food. So we must should minimize the use of all these food items. So especially when the child is malnourished or the weight is towards the downside, so then we can prescribe some Ayurveda uh, methods, just like use of Prekutu, either in combination or a single ingredient. So because supplementation of these, it used to work as a bioenhancer along the food. So that can be prescribed in use of Ayurveda nutraceutical. So very commonly practiced and used are the Kusmandavle, powder of Vidari, Bala powder with milk, roasted and powdered makhana mixed with milk, that can be given. There is a yoga of Bhava Prakash, Ashtang Sangra, that is the Preenan Modak. That can be used for weaning as a weaning food, especially to 6 to 24 months children. It contains Priyal, Laja, Yasti Madhu, sugar, and honey. We all know that about the immunity enhancer products in Ayurveda, just like Chyawanprash, Amalki, it may be given as in the form of chung or the candy, Sugandha powder, um, Guduchi. So these are immunity enhancer products in Ayurveda. Those can be prescribed to children. So now there is an advisory for Ayush practitioner about prophylactic care in children. So it is based on age group, because depending on age, one should take the medicine and calculate doses accordingly. So here in this guideline, everything is well prepared and well calculated according to the age of a child. Just like for prophylactic purpose, under 1 year, Sansamnivati, that can be used 250 milligram. So here it is 1/4 to 1/3 tablet, finely crushed and mixed with honey, to be licked 2 times a day. Decoction, there is a specific decoction, because in adults, whatever decoction we are using is having certain ingredients which are not palatable for children. So we have changed this decoction. and it contains tulsi, dalchini, shunti, haridra, draksha, jaggery. So 2 to 5 ml twice a day. Then 1 to 3 years, sansamni vati, amla murabba, or chonpras, or arvanda. So that may be given in a very specified dose. Decoction, again, the Ayush Bal Quad, the same decoction is also given in doses of 5 to 15 ml. Then turmeric milk or haldi milk, it is also prescribed in age group of 1 to 3 years. Then 3 to 6 years, again, sansamni vati. Here we used to add ashwagandha powder, 1 gram twice a day with warm milk or water. Uh, and it is especially useful if an high risk or the family member is positive. It should be included. And then again, the choice of 3 amla murabba or chonpras or arvinda. So that can be given in a specified dose along with the decoction 2 times and haldi milk or turmeric milk or the golden milk, whatever you can say, 2 times a day. 6 to 12 year, again the treatment or the advocacy is same. Sansamni vati, ashwagandha. Again, the options of amla murabba, chonpras, arvinda, so is there, decoction and haridra is there. Doses are again calculated according to the age group. Here, another thing is added, that is the gargle with lukewarm water mixed with pinch of haridra and sandro lavan. It may be advised for 2 times. Children having the age of 12 to 18 years, so here we can use the guidelines advice for adults that may be followed, but one should consider the body constitution and agni of a child. So this is a composition of Ayush Bal Bath. It is having 6 ingredients: the tulsi, 1 part, dalchini, 1 part, shunti, 1 part, haridra, 1 part, draksha, 3 parts, and the jaggery powder, 3 parts. So this is a composition of Ayush Malpad that can be given to children very safely, and it is a palatable also. Here is a advisory for symptomatic care, meaning the children below 1 year, 1 to 3 years, 3 to 6 years, 6 to 12 years, and 12 to 18 years. So mostly for under 1 year, when fever is there, Ayush 64 is recommended. The tablets should be crushed, half tablet mixed with honey, and licked 2 to 3 times a day. Godanti Bas, 125 milligram mixed with honey, and licked 2 to 3 times a day, as per the requirement. Then the Sansamni Vati, that can be given half tablet 3 times a day, finally pressed and mixed with honey. When the gastrointestinal symptoms are there, so Bal Chaturved Churn is the best one, 100 to 125 milligram 2 to 3 times a day. Cough is there, Talisa Churn or Sitopaladi Churn, based on the whether it is dry or wet. We can select, and it is given in 250 to 500 milligram dose with honey 2 to 3 times. So the same drug combination is used in 1 to 3 years, especially when cough and cold is there. So here we added Haridra and additionally doses are changed. In 3 to 6 years, again for fever, Ayush 64 is recommended. Gastrointestinal symptoms, Bal Chaturved is the best. Cough and cold, again the Talisad, Sutopaladi or Haridra Khand is recommended. In the same way, 6 to 12 year doses used to change. In 6 to 12 year age, Ayush 64 1 to 2 tablets twice a day is recommended. Bal Chaturved 500 milligram twice a day or thrice a day as per the requirement. Talisat churn, it is 2 to 3 grams with honey 2 to 3 times a day. Aridrakan 2 to 3 grams with honey or lukewarm water 2 to 3 times a day. And again for children between age group of 12 to 18, general guidelines advice for adults may be followed. Their body build and Agni of the child may be assessed for appropriate dose calculation. So these are certain referral criteria. So 5 features if you observe in a child, I think that is the cutoff line when we may ask for referral or to take the help of any expert. The first is the fever lasting beyond 4 to 5 days. Oxygen saturation is dropping below 95%. There is a decreased oral intake by the child. Respiratory rate is increased and child becomes lethargic. So when all these 5 points are there, it is best advisable to take the opinion of any specialist. Now there are certain news which are flashing in media. What will be about third wave, whether the children they will be more affected or not. So I have scanned the media and the information is collected to share with you. So initially the coronavirus, it was published in Hindu. Coronavirus frequency of infection in children similar to that among adults. So every day the concept is changing. So it was the initial concept. Then certain cases of mucormycosis post-COVID, during post-COVID recovery were observed even in children also. It is a news of Osmanabad that at least 65 children test positive for COVID-19 in Maharashtra, Osmanabad in last 4 days. Then again after certain days, COVID infection rate largely stable in minors in last 6 months. So that news was in Times of India. Again, so this is the information collected in tabular form from November 2020 to April 2021. How the children of different age group used to get affected with this COVID infection. So mostly the rate was higher in children in February 21, 4.08, and especially in children in the age range between 12 to 17 years. So the smaller children were observed least percentage in second wave. Now the latest study. The third wave of COVID-19 won't pose greater risk in children. This study is being conducted out by AIIMS New Delhi and WHO. So they have included about 10,000 cases in this study, and they find higher seropositivity in children. So the paper is from AIIMS, it is published. So whatever means this data is there. So it is simply, this data is simply of Delhi city. So in 7 out of 700, 390 children, they have shown the seropositivity. So especially the children above 18, they are having higher positivity, seropositivity in comparison to children 2 to 17. So it is a little bit less. But of course, it is more than 50. So considering this seropositivity, it is thought that even if the third wave will be there, children, they may get affected, but the severity may be less. And due to this seropositivity, even the involvement of children may be less. But I think at this point of time, nobody can predict. So the best way to prevent COVID-19 is to avoid being exposed to the virus. So in these two waves, we did it, working together, and definitely, even if unfortunately if third wave is there, so we will again win with the help of our corona warriors. So thank you for being a lifesaver. Thank you very much.
Thank you, sir, for your excellent lecture. You still don't have any views to share? So,
I think it is quite
yes,
okay.
Correct.
All the points has been already covered.
Yes.
Still, if somebody is having any question,
Okay.
that is most welcome.
Okay, I think there are no questions. So, Deshmukh sir, Dr. Shrikantji Deshmukh sir.
Yes, sir.
Yes. You want to have some comments, or we will conclude now?
No, sir. Conclude.
Yes.
Conclude.
Okay,
Thank you very
sir.
much, sir.
Okay.
Sir,
So,
it was nice occasion, and it was very elaborative and lucid talk. It's very nice for our faculty members and students.
Thank you. And
thank you, sir. Thank you.
It is based on the advisory issued by the Ministry of Ayush, Government of India, and that is available. That is available from the Ministry of Ayush website.
Yes, sir.
Anyone can download from there.
Yeah, thank you. Yes, sir.
Thank you very much. Thank you.
Thank you very much.
Thank you for inviting me.
Yeah.
Please.
Over to Torne, sir. Over, sir.
I request the coordinator of this lecture series, Dr. Pradeep Bavale, sir, to deliver a vote of thanks. Bavale, sir.
Network issue.
There is some network issue. I request Honorable Dr. Deshmukh, sir, to kindly deliver the vote of thanks so we can conclude this session.
Yeah. Sir, thank you very much, Professor Abhimanyu Kumar, sir, Honorable Vice Chancellor of Shri Sarvapalli Radhakrishnan, Rajasthan Ayurveda University, and all these coordinators team from the our MHS Nashik, and also Dr. Ashutosh Gupta, sir, is the president of our Maharashtra Council of Indian Medicine, Bombay, and he has coordinated and he has arranged this lecture series, and sir, Honorable VC sir has consented to be here for this lecture series, and also all my colleague fellows and principals of Ayurveda institutions, also my all the PG scholars, faculty members, students and PhD scholars to be here for this seminar. And I wish we can arrange such type of lecture series, and we will have such type of eminent speakers, and I will request Dr. Abhimanyu Kumar sir to be here, and we will have some MOU type of activity with the university, and we have international educational hub in our university, and through which we are arranging some MOUs. So I will request to have our MOU in between our both universities to continue this type of association for the long time. Thank you very much, Sam. And once again, I would like to thank all our colleague fellows and our participants. Thank you very much.
Thank you. Namaste.
Thank you, sir. Thank you, sir. Namaste. Thank you very much. Okay. Okay. Deshmukh sir, shall we stop meeting here?
Yes, sir. Yes, sir. We'll
I
continue.
request Avani sir to kindly give the information about tomorrow's lecture.
Yes, sir. Yes, sir. Just a minute. Thank you, sir.